This is Fox 5 News This Morning, local Las Vegas.
All right, 8:40 right now. Not getting a good night's sleep. It could be sleep apnea.
Yeah, up next, an expert joins us live in studio with more on the condition and the one sleeping position that can help you get a whole lot of rest.
But first,
all right, hey everybody, welcome back to Fox 5 News This Morning. It's 8:44. So waking up in the middle of the night, some of us do, right? Maybe it's you. It might not be just a case of restlessness. It could be sleep apnea. And here with more about sleep apnea is Dan Levendowski. Dan, thank you so much for being here. First of all, tell everybody why you're here in Vegas.
Thank you, Monica. I'm here in Las Vegas with the American Association of Respiratory Care. This is our 60th International Conference. And one of the hot topics that we're talking about is how to reduce the likelihood of a patient having a complication after surgery as a result of undiagnosed sleep apnea.
Okay, let's take it from there. First of all, what is sleep apnea?
So sleep apnea is when the airway collapses and you stop breathing during sleep.
Wow.
It happens in many cases because the tongue falls back into the airway and that obstructs the airway.
That sounds really scary.
It happens that anywhere between 40 to 60% of people over the age of 50 have symptoms that are indicative of having sleep apnea. So it doesn't mean that they have it, it means that they may have it. So some of those symptoms include loud snoring, hypertension, if they have a body mass index over 32. In many cases, their bed partner observes them stop breathing during sleep, and those are all indicators that suggest that if they go in and get diagnosed, and even if they're treated 2 weeks prior to surgery, they'll have a better outcome. They'll recover faster.
Okay, now speaking of surgery, you say that post-surgery it could be a dangerous time for sleep apnea. Explain that.
The general anesthesia tends to relax the muscles. It makes the airway more susceptible to collapse. In addition, when you're on pain medications and sedation, that also makes the airway more likely to collapse. So somebody who may have mild sleep apnea, it will become more severe in those days right after the surgery. And especially when they're sent home.
Okay.
So there's a couple of things that can be done. One is we have invented an appliance that protrudes the jaw. It's similar to an athletic mouth guard.
I was about to say that looks like something you can get at the dentist's office.
But what it does is it positions the lower jaw forward that pulls the tongue forward and keeps it from going back, falling back, and blocking the airway.
And causing all that snoring and the cutting off of your breath,
Exactly.
Right? Okay. So the bottom line is if your partner suspects it because you're snoring loudly, that could be a sign, not that you're disturbing everybody, but you got a big issue. You should talk to your doctor right away.
Absolutely.
All right. Well, Dan, thank you so much. We appreciate that. Have fun in Vegas at the convention.
Thank you
and stop
very
by
much.
anytime. All right. It is 8:46 right now. Jace?
all right, guys, thank you. Well.